Do I have to get an epidural?
So no, you don't have to get an epidural. Women have been having babies for thousands of years without any kind of epidural pain control when they have their babies and when they go through labor. Epidurals are a modern convenience, though, and you can certainly use that.
I guess it's a convenience, but it's pretty standard.
Here, probably
available on most labor
75%
delivery units. So
of women get epidurals.
That's an individual choice. Doesn't really matter what percentage any individual labor delivery unit.
And I think there's a couple things you have to consider here. Other practices and in other hospitals may be different. But here, my counsel to my patients is when you choose to get an epidural, you want to consider a couple things.
Okay, what's that?
First of all, if you get it too early, then it will wear out, and you may end up
what kind of epidurals y'all giving over there?
Or much more
it's
than
a continuous infusion.
At the time of delivery.
Continues the course of the labor and pushing. Sometimes it might need to be replaced.
For that reason. And secondly, if you get it too early,
that's not true.
It can actually slow down your labor.
There is no credible evidence that it slows down labor or results in a C-section.
A C-section.
Oh, okay.
That would be kind of silly if you ended up with a C-section because you got an epidural,
There's no evidence to support that.
So you want to make sure that you don't get it too early. My general rule, wait until you're 4 centimeters dilated or more.
That's a pretty antiquated and paternalistic approach. Patients can get an epidural whenever they want. The 4 centimeters was back when I was training 22 years ago.
Here at Boca Raton Regional Hospital and
it's not like that anymore.
We have other pain methods, pain control methods such as
there are other pain methods, pain control methods available.
We also have nitrous oxide, which is a gas you can inhale, also known as laughing gas. But the dose that they give you is much lower than what you would see in a dentist office or something like that. And that can be used through labor to help get you through the pain. Also, warm water helps. Some people use tubs to sit in to help with the pain.
If the labor and delivery unit offers it, not all of them do, but it would be nice
to know
that's available. You might want to ask
to see
if they do.
The hospital will allow it, and all of that. You have to consider: is your water broken? Are you having bleeding? Is there some problem?
There's certain conditions or complications of pregnancy where there's
we need to
more preferred options for anesthesia or analgesia.
So let's say you're more than 4 centimeters dilated. You haven't gotten epidural. And you're still you're in pain, but not enough to request it. You can keep going in your labor, and at some point, you're going to get too far along to get an epidural. For us, generally, that's around 8-9 centimeters.
It's not what for us; it's for them. That's what
you're going
they
really
want.
Fast in your labor.
We don't make that determination.
When you request an epidural, at least in our hospitals here, the anesthesiologist will come in and talk to you, make sure you understand the risks of epidural. And then they'll allow you to get it, but there's some medications they have to give you prior to giving you the epidural. And those medications take a little while for you to get.
It's a patient's choice. We don't allow them anything.
Infusion of fluids through your IV.
Yes, you have to get IV fluid before the epidural. Prior to getting no, it's not always an hour.
Just remember, more than 4 centimeters before you ask for it. When you ask for it, it's not going to come for an hour.
It's antiquated. No, it depends on the labor delivery unit, how long they have to wait.
Close to being too late. You don't have to
There's
get an
potential to be
epidural if you
too
don't want
late,
to,
but that's
if you want
dependent on the
one,
individual.
do it at the right time.
Okay.